Hello, I'm Crystal Penny, and this is my bone video of the axial skeleton. We're going to begin with the cranial bones. This front bone here is the frontal bone. We have the two parietal bones here and here, as well as the occipital bone back here. We have the external occipital protuberance, which is here, and this is used to anchor many neck and back muscles. We have the temporal bone, which is this region here, and we have the temporomandibular joint, which is this region in here. We also have the mastoid process, which is this region here. The styloid process is this pointy part right here. The external acoustic meatus is this region right here. And the squamous part is this region here. Moving on to the internal view, we have the petrous part of the temporal bone, which can be seen here. And this houses the middle and internal ear cavities. We also have the internal acoustic meatus, which is here. What passes through that opening is the ear canal. The sphenoid bone is this region here, and the superior orbital fissure, it's hard to see but usually looks like a slit, and it's usually somewhere in this region right here. And what passes through that opening are the cranial nerves. Okay, on the internal view, we have the lesser wing and the greater wing of the sphenoid bone. We also have the optic canal, are right here. The optic nerves pass through those canals, openings. The tela turcica is this area here, and the pituitary gland sits in this fossa. The ethmoid bone is this region here. We have the crista galli, which is this part here, and this helps secure the brain in the cranial cavity. The cribriform plate is this section here, and the olfactory nerves pass through those holes. Okay, moving on to the sutures. We have the coronal suture, which is this suture right along here. The bones that make up this suture are the frontal and then the parietal bones. We have the sagittal suture, which is this line here, and this one sutures together the two parietal bones. We have the lambdoid suture, which is this one right here, and this sutures together the occipital bone with the two parietal bones. We also have the squamous suture, which is not visible on this skeleton, but it would be in this region here, and it would suture together the temporal and the parietal bone. Okay, moving on to the facial bones, we have the maxilla, which is the upper part of the jaw. We also have the alveolar process, this area right here, which is what holds the teeth in place. We also have the nasal, which is right here. The zygomatic, which is right here. And the two bones that form the zygomatic arch are the zygomatic process of the temporal bone and the zygomatic bone. We also have the ethmoid, which is hard to see in this skeleton, but it would be right next to the lacrimal bone. So it would probably be somewhere right here. We have the vomer, which would be right here. And the two bones that form the bony nasal septum are the vomer and the ethmoid. The inferior nasal concha would be on the lateral sides, right here and right here. These bones form the lateral walls of the nasal cavity. We have the mandible, which is this lower part of the jaw. The body of the mandible would be here. The angle of the mandible would be here. The ramus of the mandible would be here. The mandibular condyle would be here. The mandibular notch, this part here, this little curvature. And the coronoid process is this part here. Moving on to the vertebral column, there are 4 curves of the adult vertebral column. The curves here, we have the cervical curve, the thoracic curve, the lumbar curve, and the sacral curve. The 2 primary are the thoracic and the sacral, and the 2 secondary are the cervical and the lumbar. There are 7 cervical vertebrae that are right here. This C1, this top one here, is the atlas, which articulates with the occipital condyles and allows us to nod our head yes. That would be this motion here. What is unique about the transverse processes of all cervical vertebrae compared to those of the thoracic and lumbar vertebrae is that they contain foramina, which allow the vertebral arteries to pass through the transverse process to service the brain. There are 12 thoracic vertebrae, which are from here to here. And we have the spinous processes, which are these pointy parts here. We have the transverse processes, which you can see here and here. We have the intervertebral foramen, which you can't see, but it would be in here where this spine is. We have the spinal cord, which is what passes through that foramina. The body, or the centrum, you can see here. And the position of the invertebral discs are these right here. And they are pointing downward. There are 5 lumbar vertebrae here. We also have the sacrum, which are 5 vertebrae fused together to form this bone here. And we have the coccyx, which is this bottom section right here. Okay, we're moving on to the sternum. So we have the manubrium, which is this top section here. The body, which is this section here. The xiphoid process, which is this right here, and the jugular notch, which is this little curve right here on the top. Moving on to the ribs, we have 7 true ribs, which are ribs 1 through 7, and these are called true ribs because they attach directly to the sternum by the costal cartilage. We also have 5 false ribs, which are these ones here, and they are ribs 8 through 12. They are called false ribs because they do not directly connect to the sternum. They are either indirectly connected or they are not connected at all, which brings us to the 2 floating ribs, which are ribs 11 and 12. The bottom 2, which do not connect to the sternum at all. This is the head of the rib here, the neck, and you can't see it, but the tubercle of the rib would be in this region here. And each rib articulates with the vertebrae through 2 faucets that join onto that vertebrae.